Mental health, two words that carry immense weight, especially in 2024. We live in a world that's more connected than ever, yet many feel profoundly alone. Our lives are filled with unprecedented pressures, from social media comparisons to economic anxieties. In the UK, the state of mental health is a pressing concern, a silent crisis affecting millions. We see the headlines: rising rates of anxiety and depression, overwhelmed mental health services, and a growing sense of despair. But behind these statistics are real people struggling with real challenges. They are our friends, our families, our colleagues, and perhaps even ourselves. This is not just a matter of individual well-being, it's a societal issue with far-reaching consequences. Mental health impacts every aspect of our lives, from education and employment to relationships and physical health. The cost of ignoring this crisis is enormous, both in human terms and economic burdens. This essay will delve into the state of mental health in the UK in 2024. We'll examine the statistics, explore the challenges, and shed light on the human stories behind the numbers. But more importantly, we'll also look at the glimmers of hope, the positive shifts, and the collective efforts that are paving the way for a brighter, mentally healthier future. Young people in the UK are facing an unprecedented mental health crisis. Recent studies reveal alarming statistics. Anxiety rates among teenagers have skyrocketed, with 1 in 4 experiencing symptoms. Depression and self-harm are also on the rise, painting a bleak picture of a generation struggling to cope. The reasons behind this crisis are complex and multifaceted. Social media plays a significant role, bombarding young minds with unrealistic expectations and fueling a culture of comparison. Academic pressures, economic uncertainties, and the climate crisis add to their anxieties. The consequences are devastating. Mental health issues hinder academic performance, disrupt social development, and increase the risk of serious mental illness in adulthood. We are failing our young people if we do not address this crisis with urgency and compassion. The National Health Service, NHS, the cornerstone of UK healthcare, is buckling under the weight of the mental health crisis. Despite its best efforts, the NHS is chronically underfunded and understaffed when it comes to mental health services. Long waiting lists are the norm, with many individuals waiting months for essential treatment. This lack of timely access has dire consequences. Individuals in crisis are left without adequate support, their conditions worsening while they wait. The strain on the NHS also impacts physical health care, as mental health issues often manifest in physical symptoms, further burdening the system. The situation demands immediate attention. Increased funding, expanded mental health services, and a focus on early intervention are crucial to alleviate the pressure on the NHS and ensure timely and effective care for those in need. The statistics paint a stark picture, but they fail to capture the human toll of the mental health crisis. Behind every number is a person, a story, a life impacted. Let's meet Sarah, a 25-year-old struggling with anxiety. She describes the debilitating fear that grips her daily, making it difficult to leave her house, hold down a job, or maintain relationships. Then there's John, a 50-year-old battling depression after losing his job. He talks about the overwhelming sense of hopelessness and despair, the loss of motivation, and the difficulty in finding the strength to seek help. These are just two of millions of stories. The mental health crisis is not an abstract concept, it's a lived reality for countless individuals across the UK, impacting their lives, their families, and their communities. Despite the bleak realities, there are glimmers of hope emerging in the UK's mental health landscape. Awareness is growing, and the stigma surrounding mental health is slowly starting to dissipate. More people are comfortable talking about their struggles, seeking help, and supporting others. The government has also taken some positive steps. Increased funding for mental health services, though still insufficient, is a step in the right direction. Initiatives aimed at early intervention and prevention are also showing promise. While these efforts are commendable, much more needs to be done. Sustained commitment, increased investment, and a holistic approach that addresses the root causes of mental health issues are crucial for lasting change. The fight for better mental health is not confined to government policies and healthcare institutions. Across the UK, individuals and communities are taking action, raising awareness, and advocating for change. Grassroots organizations are sprouting up, offering peer support, education and advocacy. Social media, often blamed for contributing to the crisis, is also becoming a platform for positive change. Online communities provide a space for sharing experiences, finding support and breaking down stigma. Influencers and celebrities are using their platforms to speak openly about mental health, encouraging others to seek help. These public actions are essential. They demonstrate the collective power of a society that cares, a society willing to stand up and demand better mental health for all. The road ahead is long and challenging, but there is hope for a brighter future. By acknowledging the scale of the crisis, investing in solutions and working together, we can create a society that prioritizes mental well-being. Imagine a future where mental health is given equal importance to physical health. A future where timely and effective support is readily available to all who need it. A future where open conversations about mental health are the norm, free from shame and stigma. This vision is achievable, but it requires collective action. We must all play our part: governments, healthcare providers, communities, individuals. Together, we can build a UK where mental health thrives. The state of mental health in the UK in 2024 is a complex issue with no easy solutions. We are facing a crisis, but amidst the challenges, there is hope. By acknowledging the severity of the situation, committing to meaningful action and fostering a culture of support and understanding, we can create a brighter future for all. Mental health is not a personal failing, it's a shared human experience. We all have a role to play in creating a society that values mental well-being. Let's work together to build a UK where everyone has the opportunity to thrive mentally and physically. The time for action is now.